Is healthcare free in Russia or is it private? We actually have two systems. You can go private if you want or you can go public, but the public system is actually quite good. And for example, we actually had a family member today that has been sick for several days. And so yesterday we called for a public doctor to come. And instead of having to take this person to the hospital or doctor, they prefer to keep sick people away from other sick people. So the government sends a free doctor to their house. Now, we mentioned that it was not an emergency, but they said, okay, then we'll send a doctor tomorrow. So today, a doctor came, a specialist, in fact, for the specific possible condition, and checked out the person, and they recommended that they go have some scans and some checkups. So we called the number again, and we requested an ambulance on a non-emergency basis. And within 40 minutes, an ambulance arrived with I guess you would call them an EMT. But EMTs here are a bit different. They're not that American EMTs are not trained well. I used to work in a volunteer fire department. We had EMTs, so they are trained. But here, they're much closer to a doctor even. And so they came, they gave this person an EKG in the house, ran some other tests, did some basic diagnosis, wrote out the thing, and then the ambulance took the person to a specialized hospital for the specific condition. And the cost? We could have gone to a private hospital as well. And private hospitals are fine, but usually use private hospitals for more like elective surgeries, because most things you don't need to wait for here. And, you generally don't really need the private hospitals for a lot of things. Anything urgent or important, you're going to wait. It's not like Canada where you could have like a knee surgery and you're waiting a year because Canada says, well, it's not life-threatening, but you can't work for a year. Anything like that will be generally taken care of rather quickly here. But I'm talking like, facial surgeries or reconstructive surgeries. Those things you're going to be a second priority. So you may choose to go private for there. We have a dual system here, and it works very well. When I broke my foot, I went to the public hospital by ambulance, and I had a similar experience. The system here is very well designed. Now, 20 years ago, 15 years ago, it was underfunded. It's definitely a lot better. They're very friendly, very catering, and no, we didn't take away from anybody in need, because if they had urgent calls, they would have taken care of them first. But the system is actually designed to handle not only urgent calls, but also house calls and things like this. And this is available not only to citizens, but any resident of Russia. In fact, if you're in a visa, if it's emergency treatment, like you get into a car accident, anything like that, they won't even ask you probably where you're from. Any other bigger surgery, routine things, yeah, they're going to check to see if you have what's called polis. But anybody who is a resident or a citizen has polis, which is the government coverage. And the private coverage, very good, very inexpensive as well. In fact, there's a decent-sized medical tourism industry of people coming here for service. And I know everybody's going to chime in about how they left Russia 10 years ago and it was crap. No, yeah, 10, 15 years ago, I remember you used to have to take your own bed sheets, sometimes your own food. It was definitely underfunded, but Russia was in still a massive economic crisis, despite what the West is telling you right now. Yeah, the sanctions, but it's not. Listen, the conditions here, whatever the economy is going through right here, it's way better than it was 15 years ago or prior. It's so much better. And not only on the healthcare front, but everything. I was here in 2000, and I remember what it was like. The country was falling apart. And especially compared to, say, Western healthcare, where who knows what it would have cost for me to send that family member and have a private doctor come here. I'd already be how many thousands of dollars into this, even with private insurance because of the deductibles, and I maybe bounce between in-network and out-of-network hospitals. There was none of that. None of that whatsoever. They took care of the person before they even asked for the coverage. And the only reason they asked for the coverage is it was not an ER type thing.